AVN of hips has become very common in the younger population. This is primarily because of unregulated steroid given during the COVID pandemic. Now, total hip replacement, although is a great option for AVN of the hip, but it is not one of the first options that we go for in young population. So for the younger population, we have other treatment modalities. Primarily what is being really used all over the world right now are stem cells. So do stem cells really work is what patients ask me very often. Stem cells, if chosen for the right patient, a grade 1, grade 2 AVN in which there is no collapse of the femoral head, can be very, very effective. But even in the best cases, the effectiveness is only about 60 to 70%. So 30 to 35% patients fail this therapy, and there is a risk of infection and fracture after this therapy in 30 to 35% patients. In any medical modality, that is a very, very high number. So if you understand the risks, if you're willing to pay the money, and if you are in competent hands, you can definitely go ahead with stem cell therapy for AVN. But remember that the rate of failure is pretty high as compared to a total hip replacement in which 90 to 95% success rates are reported.